What is acute transverse myelitis? That's exactly what I asked myself in February of 2009. My son was diagnosed with TM after suddenly becoming unable to walk. I'm here to inform you about the neurological syndrome known as acute transverse myelitis. I'll be going over what it is, its symptoms, its treatments, and diagnosis. I hope in informing people about transverse myelitis, or TM, is that awareness will grow and immediate medical attention will be sought if any of these symptoms strike you or someone you know. So let's get started. First of all, we need to know what acute transverse myelitis is. According to Dr. Joanne Lynn of the Transverse Myelitis Association, it is a neurological syndrome that is caused by inflammation of the spinal cord. The National Institute of Neurological Disorders and Stroke, or NINDS, states that myelitis refers to the inflammation, and transverse simply describes the position or area where the inflammation is occurring. My son's case was considered acute because the symptoms appeared quickly over the course of about 6 hours, but acute can be over several hours or several days. If it had developed over several weeks, it would be considered subacute. So now we kind of understand the technical name, but what causes the inflammation? According to my son's neurologist, Dr. David Bettis, for unknown reasons, the immune system attacks the spinal cord, which causes the inflammation. This sometimes occurs a week or so after some sort of viral infection or bacterial infection. In my son's case, it was the flu. According to Dr. Lynn, TM can occur by itself or with another illness. When it appears by itself, it's referred to as idiopathic. Idiopathic TM is assumed to be a result of abnormal activation of the immune system against the spinal cord. Another example of an autoimmune disease where the immune system attacks the body is rheumatoid arthritis. In this case, the immune system attacks the joints, causing the inflammation. What are some of the symptoms? My son complained of lower backache, legs that felt like they were falling asleep, and he lost strength and control in his legs. According to the NINDS fact sheet, my son's symptoms are common, but there are others such as loss of bowel and bladder control, sensory loss, and in some cases respiratory problems, depending on where the inflammation occurred in the spine. If you take a look at this diagram of the spinal cord, we can kind of gain from here where the inflammation is affecting different parts of the body. If it occurs in the top portion, this red portion here is the cervical area, C1 through C7. This is where your body receives the signals from the brain that controls your neck, arms, hands, and muscles for breathing. So this is where, if the inflammation occurred, it would have affected his breathing. The thoracic region is this blue region. This is where the signals come for the torso and some parts of the arms. Had the inflammation occurred in the lumbar region, it would affect hips and legs, and the sacral, groin, toes, and some parts of the legs. In my son's case, he was affected in the T5 to T7 range. So everything from here below is what was affected by his TM. How is it treated? In my son's case, after diagnosis, they started high doses of corticosteroids. According to Dr. Bettis, this shuts off the immune system, which is responsible for attacking the spinal cord. My son underwent 5 days of IV treatment in the hospital. According to my research, there is no cure for TM, but since the autoimmune system is suspected, this is the first course of action. What is the prognosis? According to Dr. Lynn, 1/3 of patients with TM make a full recovery, 1/3 make a fair recovery, and 1/3 make no recovery at all. Most will only have one occurrence with TM. However, there is known to be a small percentage of a reoccurrence with patients with TM. Just a side note, your chances of getting transverse myelitis is 1 in a million. I feel fortunate that my son falls under the first 1/3 and made a full recovery. I feel this good outcome was due to seeking medical attention quickly, along with the medical knowledge of the doctors and staff at St. Luke's. This made it possible to develop a quick diagnosis and treatment plan. Today I have discussed what TM is, its symptoms, treatments, and prognosis. Hopefully this knowledge will help you recognize its symptoms in case it strikes you or someone you know. Please seek immediate medical attention. Personal stories of others with TM that delayed seeking medical attention, or worse, were misdiagnosed and this delaying their treatment, were the cases that I found that were the poor to no recovery. For more information about transverse myelitis, please visit www.myelitis.org and www.ninds.nih.gov.